To this story now, Dr. De Maayer was suspended earlier this month from the Rahima Moosa Mother and Child Hospital. Now there are growing concerns about the state of government hospitals and growing support for whistleblowers. The pediatrician who wrote a letter highlighting shocking conditions at the hospital in Coronationville. More than 130 health officials wrote an open letter to the Health Minister and Gauteng Premier that's in solidarity with Dr. De Maayer, and he was reinstated. There are reports of ongoing victimization, though, at work, which provoked another swell of support. For more on this, we're joined by Dr. Aslam Dasoo, that's the convener of the Progressive Health Forum. Doctor, good morning, and thank you very much for your time. You know, I must say that I Am campaign is honestly among the most powerful forms of solidarity and protest one has come across in quite a while. Talk to me about this campaign.
Good morning. Thank you for inviting me. You know, this campaign, we can contextualize it, I think, with the big news that's happening today. For example, on what we've heard about state capture and how it weakened the state, including the health sector, the public health system, which also then cascaded on our ability to respond effectively to the pandemic, as we saw, together with the stewardship, which was so weakened in the government. That didn't do as well as could be expected during the pandemic. But this campaign in particular is a reflection of how the deterioration of public health services has been running apace over the last 10, 15 years. And what Dr. De Maayer did was to channel the deep frustration and anger felt by health workers who face moral injury on a daily basis because they can't actually discharge their ethical obligations to their patients. And this campaign, you know, it was so spontaneous. It was groups of health workers who just decided to do this, and some just said, I am so-and-so, in an act of open defiance to the administration. And it just took off. And I should say that the letter that was published, you know, had about 135 eminent healthcare sector people, but it's gone online now. And from last night, there's about 1,500 new signatories, all saying exactly the same thing. So I think it's not just about a campaign having legs, but it's going to become unignorable by the authorities.
It's honestly these doctors daring the system to fire them, that here we are, what you did to Dr. De Maayer, try and do it to all of us and see what you'll have. But this speaks to a broader problem than when most of us had heard that we were losing qualified specialists in the public sector to the private sector. It was as a result of perhaps enticing offers which have to do with just money. Nobody assumed that these conditions were so difficult, or they were frustrated on a daily, that even if they attempt to speak out, they will then be victimized. So this clearly speaks to a different reason why we're seeing this great migration of professionals into the private sector.
Sure, and emigrating abroad, and a loss to our system, a serious cost to our system. And look, you're right, it is a broader issue. The administrative rules that apply, you know, some of them are pretty standard. You know, you'd find that in any employment contract and conditions of service that you can't go and disclose your employer's, you know, business details in the public just willy-nilly. But when those rules transgress and violate oaths taken by professionals, by health professionals, and interferes with their ability to provide healthcare, something as vital as that and as important and intimate as that, then those rules are trumped by the oaths and the ethical framework of those professionals. That's what we're actually saying. Now, if those rules are there, they were the same rules that applied during the bad old days, where there was an incentive to stifle dissent. There was an incentive to victimize those who protested against the system. What is this excuse for this government? Under this constitution, there is no incentive. So I think what we ask for, and you'll see it in the letter, is a massive review, not just an inquiry into the Rahima Moosa scandal involving Dr. De Maayer and an investigation of the conduct of officials and the CEO, but also to reimagine the public sector rules. They must become constitutionally compliant, they must be transparent, and the real upshot of that is not just to protect the likes of Dr. De Maayer and other colleagues who want to speak up. It is to finally stop the rot and the deterioration of public health services and reverse as much as we can the damage that has been caused by an uncaring, inappropriate administrative regime for healthcare.
Now, as part of that administrative regime, I understand that you're also calling for some sort of a new board that would constitute of these professionals and others that will be the ones that oversee the daily running of these hospitals. Talk to me about that.
Yeah, sure. So what we envisage with this is, first of all, a standing Public Health Administration Review Commission. In other words, it will look at the rules, it will decide whether those rules are fit and proper, and it will be an ongoing process, because this is quite complex and quite extensive. So that's why it needs to be a standing committee that's independent, that's empowered to change the rules, but also to give effect to no policy that was coming, that was tabled but never got implemented, of instituting hospital boards who would be accountable to the facilities, the staff, the community it serves, and which appoints the CEO and runs its affairs. For 20 years, the administration refused to do this. Well, we can see why. Which bureaucrat do you know likes giving up power? Now we are insisting that they do give up that power. They are there only in support, not to lead the health system. The health system is led locally by health workers, by boards and administrators at the local level, in the interests of the patients there and the communities from which they come. That's a fundamental shift in the democratic order of the government that we have now. And it must happen. Otherwise, we're going to count lives lost on a minute-by-minute basis.
And I suppose the conduct of the CEO builds a strong case for that perhaps it's time to relinquish power or share it with some of these bodies that you speak of. Mr. Dasoo, Dr. Dasoo, rather, thank you very much for your time this morning. That was Dr. Aslam Dasoo, the convener of the Progressive Health Forum.